Welcome back, viewers, to Faith and Discipline podcast. Our topic today is intermittent claudication, and our guest is Dr. Murtaza Chaudhary. He is a vascular surgeon. Welcome, Dr. Chaudhary, to Faith and Discipline podcast.
Many thanks for inviting me to contribute.
Okay, right, let's begin. Our first question is, what is intermittent claudication and what are the symptoms?
Well, intermittent claudication is a term used when people start feeling cramp into the legs while walking. This is specifically for the people who suffer from vascular disease, arterial disease, where they have blockage or near occlusion of the blood vessels.
And what are the symptoms? Is there any particular symptom associated with intermittent claudication?
In intermittent claudication, the first symptom people usually develop is after a few hundred yards, they start feeling cramp and then they have to stop. And after that, they restart their walking. And this usually becomes severe and severe until unless they usually rectify any issues which is causing this problem. The worst scenario is that people usually start feeling pain during the night time as well.
Okay.
The similar cramp. And then sometimes they usually start losing the tissues or skin break on the feet or legs.
Okay.
So this is the worst scenario where we have to do some operation for them.
Okay. So what are the reasons why it happens?
There are multiple reasons, but the basic reason behind it is the near occlusion or complete occlusion of the main blood vessels which supply the blood from the heart towards the toes, legs or calf. These are called arteries. The veins are the blood supply. We usually take the blood back from toes to heart. But I'm talking about over here is arteries. So whenever there is blockage anywhere between the blood vessel where it divides inside the abdomen or tummy and divides into for both legs up to the toes. So it's like a motorways running from for the both legs and then divides behind the knees into 3 A roads. Wherever there is a blockage or near occlusion, it causes the problem.
Can I ask what is the reason for the occlusion? Why the blockage happens?
Very interesting question. There are a lot of research done, a lot of data we have. The main thing behind is the calcification or hardening of the blood vessel. And what is the reason behind? There are a lot of factors. Diabetes is one of the major causes.
Okay.
In diabetic, this is very common. The second most common cause is the smoker.
Right.
Or people who has increased lipid levels as well or cholesterol levels.
Mm.
There are a few people who have that runs into their families as well. But these are most common. There are hundreds of other causes which can cause, but these are very common in Western as well as Eastern countries.
Okay. So as you mentioned, it is the calcification of the arteries because the heart issues are also related to the hardening of the arteries or calcification. So is it the same type of disease or
Yes.
it only happens in the legs?
Yes. Heart, it is a claudication of the heart. Whenever you have a claudication of the legs, you start feeling the cramp into the legs.
Okay.
The similar thing happen when there is a near occlusion or complete occlusion of the blood vessel going to the brain. It usually causes ischemic stroke. So these are the main blood vessels or arteries when supply heart, your kidneys, your legs, or your brain. If they have blockage or near occlusion, they usually cause the symptoms.
Okay. So is it one of those diseases that only occurs in the older patients or is it across like all the population? Younger people also might be a victim of this issue?
Most of the population, about more than 95% of the population is old age group above 65.
Okay.
Very few diabetic type 1 or very high cholesterol level, they can suffer after 40s as well. But we have seen mostly it happen after 60, 65 year old age.
Okay. So, most of the issues, either they are related to the diet or the lifestyle. So what is your opinion? Is it more towards the diet side or the lifestyle?
Well, very, very good question. But I think as for we if your lifestyle has changed significantly in last 30 years, diabetes is most common because we have less physical activities, relaxed lifestyle. We usually use more burgers, cheese, fat, but we have less calorie output. We are not burning that calories, and that is causing more cholesterol to accumulate inside the lining of the blood supply, and that start hardening and cause intermittent claudication. So definitely lifestyle has significant effect on this problem, as well as smoking as well.
Okay.
But I can't say that the non-smoker don't have the disease. Non-smoker has the disease as well, but they have the other factors as well which can cause. One of the other factor is high blood pressure as well. So you have to keep your blood pressure under control as well.
Okay, so do we have a data like how old this disease or problem? Because if we look at the data for the heart disease or the strokes, we are getting more patients coming to the hospital with these issues, and is from last 30 to 40 years the lifestyle and the sedentary lifestyle and the bad diet is to blame. So is there any data for this?
This intermittent claudication is from 1,000 years.
Okay, right.
It's not we can say that it's happened in last 5, but there was prevalence of that disease, but the incidence of disease has increased in last 20 to 30 years a lot.
Okay.
And it's growing and is getting worse and worse in more younger people as well. I'm saying that after 50 or 60, but before that it was more in age of 70 and 80.
70 and 80, okay, right. So it used to be an old age disease, but now it's
getting worse.
Getting worse. Yeah.
More younger people are involved as well.
Okay, right. So when we think about intermittent claudication, is just the claudication of the legs, it's the pain and the discomfort. But can it lead to like serious health conditions, or just like only the discomfort?
Okay. The disease, it depends which level is the problem, which level is the blockage of the artery or near occlusion of the artery. Okay. If it is in your blockage is in your thigh or behind your knee, then it usually causes the cramp into the calf muscle or foot. But if it is inside the abdomen, where it divides into 2 blood vessels for the both legs, it usually causes cramp of the buttocks as well as thigh as well. At the same time, it usually can cause problem in male like erection and ejaculation problem as well. Similarly, very rarely it can involve upper arm as well, but it is not as common as compared to the lower limb.
Okay. So how do we diagnose intermittent claudication? Because cramps can happen due to a lack of electrolytes as well. So how do we diagnose like what is the problem?
Cramps can happen with the electrolyte imbalance, yes. Cramps can happen or similar kind of a symptom can happen when you have nerve irritation due to lower back pain as well. We call as spinal claudication. But the difference between these two is spinal claudication usually start when you start walking. The intermittent usually start after a few yards of your walking and become worse, and then you have to stop and then you have to restart. The reason of having these cramps is when there is a decreased blood supply going to the muscles, it usually causes a collection of the lactic acid into your muscle, which usually cause the cramp into your calf. The other factors like spinal claudication is usually different when it starts from the back and travels whole of the leg behind your thighs. Okay. That is because of your nerves. Electrolyte is not as common, but it is there, but there's no doubt about it, but it's not as common. This is the symptom of the patient. But when they usually come to see us, we usually investigate them by examining all of their pulses of the lower limbs. And then we do special handheld Doppler test where we check we listen the heart sound into the leg arteries. And if we found that it is below average or very critical, then we ask for further scan which like CT angiogram or arterial duplex scan.
Is this like one of those diseases that can easily manageable, or it can interfere with the quality of life of the patient?
Well, if it is in the early stage of the disease, it can be easily managed by increasing your physical activities. When you increase your physical activities, your body or your legs make natural bypasses, and then like if you have a road is blocked more frequently or some road is blocked more frequently, people start using other roads and then they become wider day by day. Similar to that one, if you start doing more physical activities, the muscle in your legs and thighs start making new collaterals, new natural bypasses, and increase the blood flow as well. At the same time, because of the exercise, the size or width of the blood vessels usually increase as well. The other factor is to have a good control of your blood pressure. That is another factor which you have to, and diabetes. The other things are you have to stop or quit smoking. If you will stop smoking, it will, whatever damage it has caused already, it will not be reversed, but it will decrease the progression of further disease. The other factor which is very important is to decrease your cholesterol level by using cholesterol lowering tablets, as well as you can use blood thinning medicine we call as antiplatelet like aspirin or clopidogrel.
In terms of like quality of life, if the person is like likes to go for a walk, they want to carry on with their day-to-day activities, can this interfere with their daily life? Can it stop them doing what they used to do in the past?
Well, we usually recommend to carry on whatever they want to do it. The thing they have to stop is to smoking, good control of diabetes, and blood pressure control. Physical activity more and more is good for them because it increases the blood flow. So doing any exercises, treadmill, exercising bicycle, running or walking, it's good for them.
What person or patient used to walk or cycle before, but because of intermittent claudication, they're feeling the pain and the cramps. Can the pain become so worse, it might stop them doing the activity? Is it possible?
It is possible that it can go worse because of the progression of the disease if they will not control the risk factor which usually cause the problem. So, as I mentioned earlier in the talk, that initially the people start feeling cramp into the leg or thighs. Later on, they start developing ulcer or breach of the skin or pain during the night time. Sometimes even pain is so bad they have to sleep by hanging their legs down on the side of the bed. So these are the factors which pointed out the disease has progressed so much where we have to do some intervention.
Right, so that was my question, because obviously it might cause sleep apnea. It can cripple the person because they were very active in the past, but they can't do their activities anymore. So statistically, is it one of the diseases which is like mainly for the males or females? Who are the main victims?
It's not equally. It's more prevalence in the men. Men are more affected. Interestingly, it's less common in women, but it's worse in women. The disease is symptom-wise, the progression-wise, and the worst scenarios-wise is very bad in women as compared to men, but it is more common in men.
So, some people do strenuous activity like they play sports or cycling or things like that. How can they manage this disease and then they carry on with their life?
Stepwise exercise, where if they are going to run for, let's say, 500 yards, then we will ask them to do next week about 700 yards and the week after about 800 yards. So they have to progressively increase their running distance or walking distance. Similarly, if they're doing some treadmill or biking, they have to do the same as well. If they're doing 1 week, 1 mile without any cramp, next week they have to try to do 1.5 miles. So it's a progression. Progressively you have to increase your walking, running or cycling distance.
Which treatment option is considered safe and effective, and what options are available?
Well, it depends on the stage or severity of the symptom. If patient has just the intermittent claudication where he can walk 500, 600 yards, ask them to have a best medical treatment. Best medical treatment include good control of diabetes, hypertension, antiplatelet like aspirin or clopidogrel, and exercise program. But if disease has progressed so much where they are dependent on other people, or where they can't carry on their own work, or where they have pain during the night time or ulcer formation, then after doing the investigation, we usually treat them according to the problem. In most of the scenarios, if it is just a small lesion or very small blockage or near occlusion, we usually treat it with angioplasty, where we stretch the blood vessel with the special balloon, and if needed, we can leave the stent inside to keep it open. The other option is to make a bypass. Like if your road is too busy or remain blocked most of the time, to make a bypass around that city so that the people can go easily. Similarly, most of its length is blocked, then we usually make the bypass around it by using their own vein or synthetic material or tube.
As you mentioned, angioplasty we are done for cardiology purposes to the heart as well. This is quite invasive procedure. Do you also treat patients with any other therapies like exercise and things like that?
When I said that best medical treatment, which includes not only medication, but we have exercise program as well, where we have some special physiotherapists who usually recommend and advise the people to do certain exercises to improve the circulation of the leg, to minimize the symptoms. It has proven a dramatic effect on their life and their physical activities, walking, cycling as well.
In the physiotherapy department?
In the physiotherapy department, but they are allocated next to the vascular department.
Okay. Walk is good for everyone in general. It is recommended everyone should walk 30 minutes at least every day. But obviously, it depends on the person. If they like to walk, it is very good for patients who suffer from intermittent claudication. It can improve their blood flow in the legs as well. What is your recommendation? What is general public should do, and the patients how long should they walk, and what should be the speed of the walk? Is it like really brisk walk or slow walk? Which is best for the blood circulation in the legs?
Walk is good at any age. But there are a lot of factors which decrease your walking habit as well. Other than your psychological impact, where you usually just want to watch telly all the time, then we usually motivate the people, analyze their psychological issues. But we usually got people who are elderly. They have disabilities as well. They have other issues, arthritis as well. So their walking is not as brisk as like youngsters. But we usually recommend them to do some sort of exercise, walking, as much as they can tolerate. As I told you, stage-wise program, where we ask them to walk, if they're walking 100 yards in a week, increase to 200 yards next week. So progression they're showing, it means that the symptoms-free distance is increased with the time as well. This disease is a chronic disease, is not an acute disease where you can treat it in days. It usually take weeks or months to treat them, although they cannot go back to their normal, but they will be near to their normal lifestyle.
Okay, that was good advice. To sum up, what is your recommendation overall? How someone can prevent themselves from this disease, and people who are already suffering from it, what can they do to improve their quality of life?
People with intermittent claudication or blockage of the blood supply, either it is legs, heart or brain. Number one, they have to change their lifestyle. They have to minimize the risk which usually cause these problems: smoking, diabetes, high blood pressure. And at the same time, they have to take the blood thinning medicine as well. If the symptoms are getting worse, they have to see their GP or doctor.
Do exercise, follow healthy lifestyle, don't do sedentary lifestyle, diet and all those things. Well, people, they filter out most of the stuff. So what is your advice if someone asks you what is the major factor to improve the quality of life and for the prevention, what would you say? If they have to pick one.
Well, we have seen people, even they have bypasses, they never quit smoking.
Okay.
So it's mostly their psychological issues are the main factor. People, they don't want to change their lifestyles. They don't want to go back to, even we have seen people who usually lose their legs. We have to do the amputation because of this disease, even though they don't stop smoking. So key thing is that you have to be mentally very strong to follow the advice, to decrease the risk factor which really cause this problem.
Okay. So main theme is like they need to stop smoking.
Or good control of diabetes or high blood pressure control as well.
Okay. Right. Thank you very much, Dr. Chaudhary. I believe today's session our viewers must have found very useful. Thanks for joining us.
Thanks very much for inviting me.
Thanks for watching this episode. If you found this useful, you can share with your family and friends. If you haven't already, make sure to subscribe. If you have any questions related to this topic, you can ask in the comment section and we'll try to help you as much as we can. Thanks for watching.